What is anatomy? Anatomy encompasses both gross structures visible without magnification and microscopic structures seen with magnification. Gross anatomy refers to visible structures, while microscopic anatomy, histology, focuses on cells and tissues viewed under a microscope. It is fundamental to medicine, aiding in diagnosis through physical examination and advanced imaging. Dentists, chiropractors, and physical therapists also rely on anatomy for patient treatment. Understanding anatomy involves observation and visualization rather than mere memorization. It's about comprehending the relationships between structures and their functions in clinical contexts rather than just learning names. Important anatomical terms. 1. The anatomical position. The anatomical position serves as the standard reference for describing the body's structure location. In this position, the body stands upright with feet together, hands by the sides, and face forward with a neutral expression. The eyes are open and focused in the distance, and the palms face forward with fingers straight and together. The thumbs are turned 90 degrees to the fingers, and the toes point forward. 2. Anatomical planes. Three major groups of planes pass through the body. In the anatomical position, coronal planes are oriented vertically and divide the body into anterior and posterior parts. Mouth sagittal planes also are oriented vertically but are at right angles to the coronal planes and divide the body into right and left parts. The plane that passes through the center of the body, dividing it into equal right and left halves, is termed the median sagittal plane. Transverse, horizontal, or axial planes divide the body into superior and inferior parts. 3. Terms to describe location: anterior, ventral and posterior, dorsal, medial and lateral, superior and inferior. Three major pairs of terms are used to describe the location of structures relative to the body as a whole or to other structures. Anterior or ventral and posterior or dorsal describe the position of structures relative to the front and back of the body. For example, the nose is an anterior ventral structure, whereas the vertebral column is a posterior dorsal structure. Also, the nose is anterior to the ears and the vertebral column is posterior to the sternum. Medial and lateral describe the position of structures relative to the median sagittal plane and the sides of the body. For example, the thumb is lateral to the little finger. The nose is in the median sagittal plane and is medial to the eyes, which are in turn medial to the external ears. How superior and inferior describe structures in reference to the vertical axis of the body. For example, the head is superior to the shoulders and the knee joint is inferior to the hip joint. Proximal and distal, cranial and caudal and rostral. Other terms used to describe positions include proximal and distal, cranial and caudal, and rostral. Proximal and distal are used with reference to being closer to or farther from our structure's origin, particularly in the limbs. For example, the hand is distal to the elbow joint. The glenohumeral joint is proximal to the elbow joint. These terms are also used to describe the relative positions of branches along the course of linear structures, such as airways, vessels, and nerves. For example, distal branches occur farther away toward the ends of the system, whereas proximal branches occur closer to and toward the origin of the system. Cranial toward the head and caudal toward the tail are sometimes used instead of superior and inferior, respectively. Rostral is used, particularly in the head, to describe the position of a structure with reference to the nose. For example, the forebrain is rostral to the hind. 5. Superficial and deep. Superficial and deep are terms used to describe the relative positions of structures in the body. Superficial means closer to the surface, while deep refers to structures further inside. For instance, the sternum is superficial to the heart, and the stomach is deep to the abdominal wall. Additionally, these terms can define two major body regions: the superficial region, which includes the skin, superficial fascia, and mammary glands, and the deep region, which encompasses most skeletal muscles and viscera. Superficial wounds are external to the outer layer of deep fascia, while deep wounds penetrate through it.